Good morning, everyone. And this one is maybe the last lecture for the ECG, the basics, very basics, right? From diagnostic purposes, and of course, like when you haven't started your internal medicine and you don't know much about arrhythmias or the cardiac rhythm problems. So I'm just going to give you the overview. So arrhythmias, as we know, that there is some abnormal rhythm. Now, the thing is, the ECG recording basically note or record the cardiac electrical activity. For example, there is a very common term which most of the people they use, like cardiac arrest, like someone died of cardiac arrest. So what is cardiac arrest? Simply the heart stops pumping the blood around the body. So when the heart stops pumping blood, it means like the heart is not contracting, but which doesn't mean like the electrical activity in the heart is stopped, because there are, like, whenever there is cardiac arrest, the electrical activity in the heart does not always stop immediately. That's why immediate and advanced management of patients with cardiac arrest uh, is largely seen by exactly what is happening to the heart rhythm. So simply, in simple words, you can say someone went into the cardiac arrest, and if you had access to ECG, and you will see the ECG, like what ECG showing is showing. Because if the ECG is showing any rhythm, so based on that, we can decide either the rhythm is shockable or non-shockable. What is shockable? If you have seen that, someone who have cardiac arrest, they use defibrillators, like they give electric current on the chest so that the heart can should come back to its normal rhythm. So uh, in simple words, you can say that there are some of the rhythms which are shockable, in which we can use that shock, and some of the rhythms which are not shockable, in which we cannot use that shock. So of course, the most important thing is to identify if the rhythm is shockable or not. For example, I will give you one of the example in this regard, that is called as uh, okay, wait. Okay, there is something called as ventricular tachycardia. Simply when the heart rate is too high. For example, this one. Okay, see, the heart rate is too high. By the way, less than 300 for sure. Okay, again, that box rule you can apply here to calculate the heart rate. But For example, there is something called as ventricular fibrillation. Now, ventricular fibrillation is one of a shockable rhythm, and if you can see over here, the ECG uh, have a erratic behavior. See, none of them they look alike, and none of them they are coming to the baseline. So this is very erratic nature of the electrical activity. Okay, it is random, it is unpredictable, it is sometimes classified as being fine or coarse depending on whether the electrical activity is of very small and fine amplitude, or like this one, large and coarse amplitude. Okay, so this is what we call as ventricular fibrillation. And one of the shockable rhythm which I show you is also tachycardia. Okay, ventricular tachycardia. Now you can see over here, as I was telling you yesterday in the previous lecture, that one thing is about the QRS complex, like the QRS complex, either they are wide or not. So whenever the QRS complex are wide, which mean that simply they are wider than three small boxes, which means that the rhythm is originating from the ventricles. So like, see, you can see the broad QRS complex tachycardia here that are very distinctive appearance on this ECG. Okay, it is not always associated with cardiac arrest, but it is a very, very, very dangerous type of arrhythmia. So these two are shockable rhythms. Ventricular tachycardia is a shockable rhythm, as well as ventricular fibrillation. They are both shockable rhythms, and in these are the one which in which like we use uh, shock. Okay, so now you can see over here. Um, wait. There is something called as torsade deep pointers. Now, how we catch on ECG like someone have torsade deep pointers? So the ECG somehow looks like this. You can see that there is big and then small and then again big, then again small. So uh, now, what is the importance of this thing? Uh, this Torsades deep pointers. Okay, first of all, I would like to tell you what is Torsades deep pointers. In French, Torsades deep pointers, like the exact meaning of this thing, it's basically French word. It is like twisting around the strings or twisting around the peaks. Okay, so you can see over here, see, like basically this one is broad, then narrow, then broad, then narrow. Okay, like I'm not talking about the QRS complex, I'm talking about this one. See, this one are broad, then small. So they are oscillating. Oscillations you can see and narrow. So it seems like they are twisting like this. So this is called as Torsades three pointers, right? So now uh, these are two shockable rhythms, right? Now there are many, or there are two main, you can say, non-shockable rhythms. So when we say that someone has non-shockable rhythm, is simply when defibrillation will not help. Like, to many of you who don't know what is defibrillation, I would rather show you over here just to make up your concepts about this one. So defibrillators, fibrillator. The good thing nowadays, like in developed world, there is defibrillators which are available like almost everywhere. You can say they have installed them in the supermarkets, at the airports. Okay, like they look like this. Some of them they are big, and some of them they are very small, like this one, right? And all are these are defibrillators. And the good thing, like nowadays, see a very small defibrillator. It's very easy to use. They guide you. They give you the instructions, like put one patch on the right upper chest and one patch on the lower chest, and then it will tell you that, okay, leave the patient, don't touch the patient. I am assessing the rhythm, and I am assessing if the rhythm is shockable or not shockable. So nowadays the defibrillators are doing a lot of job. The defibrillators, what they do, uh, you can see like automated electronic defibrillator. So nowadays the defibrillators, like they check themselves, like either the uh, rhythm is shockable or not, and if the rhythm is shockable, it will deliver the shock itself, right? So one of the thing is called as uh, okay, so if whenever anyone go into a shock, cardiac shock, nowadays, like if you have access to this defibrillators, you will put on the patient. The defibrillator is doing a lot of job. It will assess the rhythm. It will see either the rhythm is shockable or not shockable. If it is shockable, it will deliver the shock. Like if it's ventricular tachycardia, ventricular fibrillation, it is going to deliver the shock. So, but if the rhythm is non-shockable, then the defibrillators, they are of no use. And of course, like we must go for CPR, which is cardiopulmonary resuscitation. Okay, so of course, in that case, we cannot do much. We cannot make use of these. Rather, we go for CPR. So one is called as pulseless electrical activity, or PEA. Okay, so this is like the ECG of pulseless electrical activity. You can see uh, there is no pulse, and but just there is a little electrical activity uh, in the heart, and in these this is a non-shockable rhythm. So this is what you can say. And there are many ECGs, like, of course, you can see on the internet, of course, like, which will tell you the pulseless electrical activity. So the heart rhythm in this case is indistinguishable from a heart rhythm normally compatible with the life. Okay, and one thing is called as asystole. Okay, asystole. So uh, now asystole, you can see over here, like one of my student, by the way, I show him this ECG, and I ask him, like, can you define this ECG, and he used the word, death. So this is death. So uh, this is called as asystole. And of course, like, there is no identifiable cardiac electrical activity. Okay, so by the way, it's not like that much straight, rather it could be like some, you can say, yeah, it could be like this, like a little variations in the line. So this is called as asystole, right? So this is asystole, that is PEA, or pulseless electrical activity. So this is what happens. Okay. There is one also which is called as um, P wave asystole. P wave asystole. So what happens in this one? See, you can see, like, only we can see the P waves, but there is no. See, P waves means what? Atrial activity is there. Okay, atrias are contracting, but we cannot appreciate any ventricular activity. Ventricular activity in this one. So, by the way, for example, someone have this, P wave asystole. So of course, like, the only thing is cardiac pacing. So what is cardiac pacing, by the way? Of course, like, we cannot do it in emergency, like when the patient is outside any specialized care. So basically, what is cardiac pacing? See, like, now we are going towards treatment. What they do is, like, they put a pacemaker in the chest. Okay, and they put wires in the heart. So this is the one which keep on delivering the current to the heart, and the heart beats, right? This is called as. So see, they put a pacemaker, and see, the wires are going inside the heart, you can say. You can see over here, the wires are going inside the heart, and they are the one which are delivering the electrical activity, and the heart is contracting. So this is called as pacemaker, right? So simply, like, guys, these are the what you can say, uh, what we say, like, shockable and non-shockable rhythms, right? I think so, like, at this stage, like, it's enough for you guys if you can remember this thing. That's it. um, don't go in, like, too much details. There is no point in going in too much details right now, because you guys are not familiar with much of the basics. So like, this slide is not meant for you, or not made for you, rather in this slide, like, there is a lot of what you can say, details of the ECG. For example, what is sinus rhythms, what is ectopic rhythm, what is sinoatrial blocks, AV conduction delays, interventricular. Okay, so the point over here is, like, simply, um, I just wanted to tell about the basics of ECG, and if you can know the basics of ECG, I think, like, the things will be easy for you, right? Rather than what you can say, going into much detail. Okay, so now, guys, I just want to revise, or what we have done so far, just to tell you. See, during these lectures, uh, we, like, what we did, number one, uh, of course, like, I gave you a very brief introduction about ECG. Then I told you what are the different waveforms, okay, and then I tell you how to calculate the heart rate, and then how to see the heart rhythm, okay. uh, Other than that, what we do, we see like how we can check cardiac access. If you remember, like, that uh, 1 2 3 lead method, or uh, that AVF lead method, right? So whatever, like you like. Then we check for the P wave. We see like either the P wave is of normal voltage and normal size, and if there is any abnormal shape like P pulmonale or P mitral. Then we talk about the QRS complex, like simply, sorry, before that, we talk about one more thing, that is uh, PR interval, right? And I told you what is the normality in this one and what is the abnormality in these patients, okay. Then we talk about the QRS complex. I told you what is narrow, what is wide, how long it would be normally, and what are pathological Q waves, okay. This thing. Now, then we talk about, yes, ST segment, right? In this one, I talk about like whenever there is elevation, what can be the could be the causes, and what when there is ST segment depression, what can be the causes. A very brief introduction about QT interval. As I told you, like many people who have long QT syndrome, they are more prone to get arrhythmias. Okay, then I talk about the T waves. Okay, now like just to tell you guys uh, a little more about the waveforms. Okay, um, now one of the thing which I think was like during one of the slides, it came and they were showing you U waves, right? So now U wave, again, I will show you how U waves look like. So PQRST one thing is simple. So remember, it comes after T waves. Okay. So I will show you again uh, U wave ECG. So see, like this is PQRST and then again a U. So it appears like this way: PQRST and then U, right? So uh, now in a real ECG, if you want to see, yes, it's in front of you. So see, there are a lot of U waves, right? So the U waves, like you don't have to remember them first of all, right? Because I'm just explaining because they came into one of the ECGs, right? So maybe like just to tell you, like I'm not missing this thing. Basically, U waves, the origin of these U waves are still questionable in many of the instances. For example, uh, the point over here is that uh, sometimes they can occur due to some causes. And if you want to remember one cause, just remember hypokalemia, right? They can be seen in hypokalemia. But sometimes in sinus bradycardia, we can see U wave as well. Sometimes in when the patient is on some anti-arrhythmic drugs, we can see U waves. Okay, so this thing, and sometimes this U waves can be inverted as well. Okay, or you can say a negative U waves can be seen as well, like in myocardial infarction they can occur. So that's it. Like there is nothing important more than that for this one. And other than U wave, I want to show you one more waveform only, because maybe like sometime you can get a question for them. So J wave, it is called as J wave. Okay, so J wave is also called as Osborne wave. Osborne wave. Osborn. Osborne wave. So you can see like this is QRS complex, but you will see like there is one more thing over here or here or here, right? To see closely. If you can see like QRS and see one more, one more. So this is called as Osborne wave or J wave. Okay, now it is also called as camel hump because it's like a hump. Uh, now, um, they are also called as hypothermic wave. So if they are called as hypothermic wave, remember J waves or Osborne waves are seen in the patients when they are suffering from hypo. hypothermia. Okay, but they can also be seen in the patients who have high levels of calcium in their blood or in brain injury. But the most important thing, or this question can be only asked from undergraduate students from just in just one context, that is, if you will say hypothermia, that's enough. Okay, so this is how Osborne waves look like, or this is how hypothermia is. So that's all, guys, for the ECG things. And after T waves, we like I also talk about J wave. Okay, and which is also called as Osborne wave, as well as Uwave. Okay, not so important. I'm telling you, okay, it's not so important to go in detail of that. So thank you so much, guys, for listening. And like in the next lecture, that will be the last lecture for you can say uh, diagnostics. I'm going to talk a very short lecture. Even this one is very short lecture. I'm going to talk about the other imaging or investigative modalities in cardiology.